Hi Year 11, this year to try and help you prepare for your mocks, we're going to start doing some narrated PowerPoints. Now some of you might have already heard that Miss Bowden has already put one on Show My Homework for all groups. Please check that out if you're unsure about any of the key individuals that you need to study for the mock. What this PowerPoint is going to be on is a narrated PowerPoint on public health over time. There won't be anything new or different to what was said in your lessons, but the idea of this is that if you miss that lesson, you can look through this PowerPoint and listen to it again. And also, if there are areas that you were a little bit unsure of, maybe you didn't get time to make any notes, you can go back and go over those areas that you need to. So all of this is for your mocks that are beginning on the 9th of November. Remember that your history one is going to be a 1-hour exam on health, and that's going to be happening on Thursday, the 12th of November. Just briefly, before we begin, I just want to remind you again of the specific topics that you're supposed to be revising with health. So we've got on the left-hand side here all of the key areas that you need to know about. These are all on Show My Homework as well, and the ones that we've discussed in lesson. Now, also, all classes have a list of suggested activities that we think would be really helpful for you to complete over half term. Now, today, one of them that we're going to be talking about is public health. We're going to be going over all 4 time periods. Now, I know lots of you already completed an A3 sheet where you made some brief notes based on what your teacher was saying, but we also think it's a really good idea, if you can, to make a revision clock where you have the 12 headings that we talked about in lesson. If any of you are unsure at all, then please just message your teacher on Show My Homework or email them and we'll give you what those headings are. But the idea is that you're then going over those notes regularly. Public health is the really key bit for this exam because it's going to be worth 16 marks and the other 3 questions are worth 8 marks each. So all of them are obviously very important, but it's really crucial that you know about public health in detail because you are going to have a factor-based question on that. Let's talk about public health in medieval times. Now, when we're talking about this medieval period, we're thinking about the year 1000 to about the year 1450. Now, generally, we need to understand that living conditions at this point are really poor. We can see that from the picture in the top right that we annotated together back when we were in year 10. We know there were so many different issues. Houses crammed together, no access to clean water, no understanding about the importance of clean water, not until 1854 with John Snow's discovery about cholera. Most people actually used to drink beer rather than drinking water at this point. Then we've got a second bullet point there about another big problem with public health in the medieval period, and that is that there were few regulations for buildings and waste disposal. Now, up until 1388, there were essentially no laws about what you could throw outside. Butchers were allowed to slaughter animals in the street, people were allowed to throw their toilet waste and their household waste generally out into the streets. And the idea would be that eventually the rain would wash those bits of waste away, or animals would come and eat them and things like that. Remember, obviously, it's very different to today because they're not getting rid of anything like plastic. Now, the reason why things were so bad is because the government didn't see it as their responsibility. The government didn't take a real role in public health up until the 1800s with the first Public Health Act. So at this point, they did have some laws, but these weren't enforced regularly. There's no police force. There's nobody really taking responsibility here for public health. There were some positives about public health. For instance, there were some bathhouses left over from the Roman period where you could pay to have a bath. And they did have some people called gong farmers who would clear out human waste from cesspits. However, generally, we've got to remember that things were pretty awful. This is a period where they feel like they can throw their waste out into the streets and they can throw it into their rivers. And obviously, we know it's contaminated their drinking supply. They would often do things as well, like selling food that had gone out of date. There wasn't any food standards and food regulations. So generally, public health in the medieval period was pretty bleak. The other area of public health in medieval times that we've got to know about is about the Black Death. Now, this is something that arrived in Britain in 1348 and it came through trade. Now, that's really important to be aware of, that it originated in China and spread to other nations through trade, because in our exam answer, you're going to have to talk about the factor of communication, and this is a really key piece of evidence for that. Now, people were really, truly terrified of the Black Death, and it's no surprise that they were. If we think about the impact of it, a third of the population died. In one particular town in England, a place called Jarrow, 80% of the population there died. It also killed 25 million in Europe and 75 million worldwide. Now, those numbers are absolutely horrific in today's standards. But at the time as well, you've got to remember that the world's population was so much smaller. So this had an even bigger impact on people at the time. Now, it was terrifying because they didn't have the same sort of scientific understanding that we have now. They had no idea what caused it. They had no idea what to stop it spreading. And a lot of them felt that this was a punishment from God. And that was a really terrifying idea to those people. Now, they had no idea what actually caused it. As we mentioned, they thought it was often God. Other people had different ideas that it was caused by things like the planets being misaligned. People believed things like it was caused by different animals, bad smells like miasma. Essentially, they have no idea what causes it. Now, that's really, really crucial because if you don't know what causes something, you can't find an effective cure. And so people did all kinds of crazy things to try and get rid of the Black Death. Things like rubbing chicken bums on their buboes, doing things like swallowing frogs, doing things like also whipping themselves, doing things as well like drinking mercury. They had all these different cures at the time, and obviously none of them worked. Now, the Black Death was obviously this terrible, awful thing for the population of medieval England. But some people say that it did lead to some improvements with public health because people were so terrified by the idea that miasma might have caused this, that some places, like London and Coventry, they started to clean up in the 1400s as a result of this because they didn't want to experience this again. We get the first ever laws trying to actually require people to keep towns and streets clean. For instance, in 1388, Parliament passed a law requiring people to keep those streets and rivers clean, and that was as a result of the Black Death and the fact that there were tiny mini outbreaks in comparison to the first original one that happened after the Black Death kind of went away temporarily. So this is something that had a massive outbreak in 1348, but don't think it just completely disappeared. There were smaller outbreaks over time that happened. So now I'm going to be thinking about public health in the Renaissance. And when we're talking about the Renaissance period, we're talking about the year 1450 to the end of the 1700s. Now, just because we call it a different time period doesn't mean that things changed drastically straight away. So when we're thinking about public health in this period, we want to think about the fact that actually issues remained that had been there from the Middle Ages. So things like houses crammed together, the fact that there were poor living conditions, the fact that the streets were very dirty, and that there was a real lack of knowledge about how to improve public health. All of those issues remained at this point. Now, because those issues remained, because those streets were so dirty, because the government wasn't taking any responsibility for improving the conditions of these towns, that meant that we get lots of rats. This then attracted fleas, and this meant that germs spread very quickly. Now, in every unit, we need to know about an example of a disease that demonstrates public health and about whether there are any improvements. And the one that we need to know about for the Renaissance is the Great Plague of 1665. Now, we mentioned already that there had been lots of little outbreaks of plague. It never really went away, but the really big one that we've learned about already was 1348. Now, this Great Plague of 1665 was the second biggest outbreak of plague we'd ever had, and again, it was terrifying to the people. London lost 15% of its population. It's estimated that around 100,000 people died. So we just need to know for this period, essentially, that there were lots of issues that still remained. On the next slide, we'll look a little bit more about what the Great Plague was like. Let's talk a little bit more about the Great Plague. Now, we've already mentioned that 100,000 people are estimated to have died from this. So it was this terrible, deadly outbreak of disease. However, far less people died than they had done in the 1348 Black Death. So let's think about why. Well, lots of historians argue that there had actually been real developments and progress in public health since the medieval period. And we can see that in the way that they responded to the Great Plague. Now, at this point, there is generally very little government intervention in public health. However, when the Great Plague hits, the Mayor of London does do some really important things that actually help stop the spread of the plague. So first of all, one of the things that is done is that there's less trade with infected towns. So any town that was affected badly by the Great Plague was essentially shut off in communications from other towns. We also have quarantining done on a much larger scale than there had been during the Black Death. So there became a policy which was led by the Mayor of London, where they would close up infected houses for 40 days. If anybody who lived in that household showed any symptom of being ill with the Great Plague, they would be shut up, the door would be marked with a big red cross, would be locked so they couldn't get out even if they wanted to, and protected by guards called watchmen. The idea here is to stop them spreading the disease by stopping them communicating with other households. Like we said, very deadly and quite brutal for those that are healthy, that are trapped with family members that are ill, but it did help stop the spread of disease. The Mayor of London also does things like closing taverns and theatres, and he also orders people to sweep the streets and clean just in case it is caused by miasma, which is a very popular idea at the time. He also tries to make sure that they are stopping the spread of the disease by doing things like making graves 6 foot deep and having no public gatherings around them. He also orders there to be people to go and kill stray cats and dogs because people at the time felt that they had caused the Great Plague. There are 30,000 animals at least that are slaughtered. Now, obviously, they are not dealing with the actual root cause of what caused the plague and the fact that there was this bacteria that was spread by fleas and rats, but there's definitely been some progress since the medieval period. The fact that the government is doing more actually meant that less people died in this particular outbreak of the plague. So this is a really key thing to know about, the fact that there has been some progress since the medieval period, and most of that progress is because the government's taken a greater control over these events. Okay, so the next area that we need to know about is smallpox. Now, this is something that crosses over between the Renaissance and the 1800s period, and it was another outbreak of a deadly disease. Now, just like the Black Death, it killed between 30 and 60% of people who caught it, and 35,000 people died in the year 1796. It was a particularly bad outbreak. Now, we're going to look at the work of somebody called Edward Jenner. This is something that you did for some work over lockdown, and it's really important that you know who he is. If you don't know very much detail about him, please do go and watch Miss Bowden's PowerPoint, where she talks all about the key individuals. She's going to talk about Jenner in lots of depth. Today, we're just going to do a little bit of an overview because it's just a very small part of public health. Now, Jenner was a scientist who noticed that people who caught a disease called cowpox, which was non-fatal, didn't then catch the deadly disease of smallpox. So he had this hypothesis, this idea that actually, if you have cowpox, you won't get the deadly smallpox. So in 1796, he decided to take a gamble, and he took pus from a cowpox scab and injected it into a healthy 8-year-old boy. So this boy didn't have cowpox and didn't have smallpox either, but he's now been given cowpox, and then after about 6 weeks, Jenner then injects him with this deadly disease of smallpox. Now he realises that Pips shows no reaction, so he then goes to the Royal Society in the year 1797 and says, look, I found this amazing discovery that if you have cowpox, you won't then get smallpox. And they ask for a bit more proof. So he goes and tries it on his 11-month-old son. So he gives him cowpox, and then later on he gives him smallpox. And again he finds that his baby doesn't die. So he then decides that he's found this new thing about what is going to protect people from smallpox. Now, this was something that was really difficult for ordinary people to understand because even Jenner himself couldn't explain why this worked. Nevertheless, over time, more and more people started to believe it and realise this could actually save their lives and save them from actually catching smallpox. So by 1840, as a result of yet another smallpox epidemic, the government then made the vaccination free to all infants. Now think up to this point in terms of public health. The only thing they've really got involved in is things like the Great Plague by shutting towns and taverns and all those kind of things. So this is actually the first time the government's getting really involved in public health by paying for something for all these infants. Now in 1853, they take it a step further by actually making it compulsory. So say all infants have to have this smallpox vaccine. Now, this isn't strictly enforced, but it doesn't really matter. The idea is that the government is now showing responsibility more than they ever had before for public health. There were lots of people that liked this idea and appreciated the government getting involved and paying for this, but there were also a lot of people that didn't like it. And in 1866, we get an anti-vaccine league that was set up. Now, the death rate does fall, and by the time we get to the 1980s, smallpox is eradicated as a result of this vaccine that is developed over time by different scientists that started with Jenner. So smallpox is a really important example of the development of public health to be aware of, because it shows greater government intervention than ever before, and it shows the power of government intervention as well. The fact that after all these years they're able to get a vaccine, mass produce it, and also take responsibility making sure that parents give it to their children, then leads to one of the only diseases ever to be eradicated, which is a really special moment and shows actually the power of government intervention. So it's a great example for you to use in your 16-mark question, particularly about individuals or government. Another area we need to know about is about public health in the 1800s. Now, this is the time of the Industrial Revolution, a really key time for Britain, but a really terrible time for the majority of the population, people that were working class. Now, during the Industrial Revolution, a lot of people are moving from the countryside to the towns. Back in 1750, before it really got going, about 70% of people lived and worked in the countryside. But because of the Industrial Revolution, by 1900, it's about 30% of people that are living and working in the countryside. Most other people have now moved to the industrial towns and are working in places like factories. Now, these towns grew really quickly, and as a result of that, the housing was really poor quality. But there's also other reasons why it's poor quality, and that is because the population grows massively. In about 100 years, it almost quadruples. So all of a sudden, we've got this expanding population and nowhere for them to live. And there's also lots of other issues that make public health in this period pretty poor. And that is the fact that we've got these new industrial factories with no health and safety regulations. So there are frequently accidents. You might remember back from year 8 about, for instance, children getting their hands caught in machines, and about all the problems with the long working hours and the fact that the workers weren't looked after. Now, people lived in terrible slum housing as well. So because they're all crowded together, we often get families just sharing one room, quite often sharing one bed as well. And because of these terrible living conditions, because of the fact that there are lots of people that also don't have a very good diet and they're very malnourished, we get the spread of lots of diseases. For instance, typhoid, typhus, TB, cholera, smallpox, whooping cough, and measles. So they're just some of the examples of diseases that were spreading at this time as a result of the terrible public health at that period. Now, you might remember from lessons as well that the average life expectancy was 16 for labourers if you lived in the East End of London in 1842, and 45 if you were rich. Now, those average life expectancies are really brought down by this statistic here, with the fact that 57% of children died before the age of 5. So if we're thinking about what public health was in the 1800s, we need to think about the fact that it was this terrible time of these industrial factories, and actually ordinary people had a very tough life as a result. The key disease that we need to know about for the 1800s is cholera. And this is something that I'm going to introduce to you now, but we're going to see in more detail on a future slide where we're going to talk more about John Snow and cholera. So key to understand about this disease, it is caused by poor public health. It is caused by people not having access to clean drinking water, because you get it when you drink water that is contaminated with infected sewage from somebody who's already got it. Now, it comes to Britain in 1831, and it comes to Britain as a result of trade with India. And it was something that was very deadly. 50,000 people died in the first outbreak. But there wasn't just one outbreak of cholera. There's further outbreaks in 1848, 1853 and 1865. So it's something that kept returning to London and other cities in Europe, and particularly in London, because of the poor public health and the fact that people didn't understand the importance of drinking water. But we'll come back to more about cholera in a little bit. Okay, so we need to know about a key individual called Chadwick. Now, Chadwick's really important because he starts to change the government's attitude towards public health. Before Chadwick's report in 1842, we know that the state of towns was really poor, and we know that the government had this laissez-faire attitude, which means that they believed in self-help. They believed that generally the people should look after their own towns, and it wasn't the government's job to get involved. Now, Chadwick's report was one of the key things that changes this. So in 1842, he publishes a report on poverty and health, and he shows that living conditions in the towns are way worse than they are in the countryside. And he shows that this is having a real detrimental impact on people's health. Now, he suggests that the government should do something about this, and that the government should pass laws for proper drainage and sewage systems, and that this should be funded by local taxes. Now, this is quite a revolutionary idea. He gives out 10,000 copies of his report to politicians, to journalists, to writers, and anybody that could change and shape public opinion. And this is really, really crucial because it leads to the first ever Public Health Act in 1848, because the government started to act on his advice. So we really need to make sure that we understand that Chadwick was really crucial in changing those government attitudes. So he's a great example to use in your 16-mark question on individuals, because he causes the government to act. He causes some change. So really important, especially for our government paragraph in our 16 marker, is the first ever Public Health Act of 1848. Now, there are loads of positives and strengths of this act. First of all, it is the first act of its kind. Now, we've mentioned already some developments in public health, like the Mayor of London's actions in the 1665 Great Plague. We've mentioned things about smallpox as well. But this is the first time ever that the government is getting really involved in public health and actually taking responsibility for public health as a nation. Now, they do things like setting up a central board of health, and they do get some towns to actually improve. So places like Leeds do actually improve their facilities and take on board this government initiative, and they do things like trying to improve the water supply and the sewage systems. However, despite the fact that this is such a positive and they're taking a step in the right direction, there are lots of limitations of the 1848 First Public Health Act. One of the reasons why we need a second one in 1875 is that this first one didn't go far enough. Now, the really key weakness to know about for the First Public Health Act is the fact it wasn't compulsory. Local councils didn't have to take on board this advice. They didn't have to act on it. And if they wanted to improve public health, they had to pay for it themselves out of their local money. So it wasn't like they were given this big grant by the central government. They actually had to kind of take on board this initiative and fund it themselves. Now, as a result of that, most towns don't bother. They argue they don't have the money for it and that actually they shouldn't make the ordinary people pay for it. So it was really expensive. If we look at that figure there, £11 million was borrowed up to 1872 to fund these improvements. Now, that is a lot of money back then. We're talking about the equivalent of over £1 billion in today's money. So they did spend some money on it. However, because it wasn't compulsory, most towns chose not to do anything about this because they felt that they didn't have the resources available to do it. So there were certainly some limitations of this act, but what's really crucial to understand is that this is the first time the government's really taken responsibility for public health as a whole. So we've already mentioned that cholera came to Britain in 1831, but we also need to understand is that cholera is one of the key reasons why we get the first Public Health Act and why we get the second Public Health Act as well. Now, we know that it first came to Britain in 1831, and there were lots of different outbreaks of cholera. Different outbreaks occurred in 1831, they occurred in 1848, 1853, and 1865 as well. But the really key one to understand is actually the 1853 outbreak, because that led to the work of John Snow. Now, John Snow does this experiment where he finds that a lot of people are dying in one particular area of Soho in London, and he plots all of their deaths on a map, and he finds that all of them are actually using the same water source, which is a pump that was in a street called Broad Street. So he does things like taking away that pump, making it so it doesn't work. People have to get their water from another source, and he then proves when there's no more deaths that the deaths in that area were actually linked to that water supply. He does some further looking, and he finds that actually there was a leaking toilet that was getting into that water supply. So through that experiment in the Broad Street area of London, he is able to prove that link between contaminated water and cholera. Now, the government doesn't really act on it at first. They take on that discovery, they listen to it, but they don't immediately provide clean water for everybody. There's lots of reasons why we get the 1875 Second Public Health Act, and John Snow's discovery is crucial, but it's not the only one. So we have John Snow's discovery in 1853 and 1854, but we also have things like 1858, the Great Stink, when things are so smelly that Parliament refused to meet. Now, we also have other things that lead to the Public Health Act as well, like the fact that working class men get the vote in 1867. That is something that makes the government realise they need to do something to improve conditions, because now they've got working class people voting for them as well. So there's this whole combination of factors that leads to the 1875 Second Public Health Act, but it's definitely worth being aware of the role of John Snow and cholera in leading to that change. So other factors that led to the 1875 Public Health Act include the work of Basil Gett, which he did during the Great Stink. Now, in 1858, as we already mentioned on the last slide, there was the Great Stink that happened. Now, remember that London, and particularly the Thames, would have been smelly throughout the whole of history, especially when people were dumping so much waste into it. So when they're talking about the Great Stink, it must have been absolutely vile. I mean, it's so bad that Parliament refused to meet. So because it's now affecting them, the government decides to do something about it, and they hire a man called Basil Gett to build a new sewer system, and they build 1,300 miles of it. Now, this is really important because as a result of this sewage system, cholera never returns to London as a result of it. But also, this becomes the blueprint for most European cities, and those sewers are still around today. Yes, they've been modernised slightly, but actually it's following the same blueprint that Basil Gett installed back in 1859. Now, this is really crucial because it is the work of a genius in Basil Gett, but also it shows the government taking responsibility again to try and improve things, because they've given £3 million to try and do this. Now, if we're talking about today's money, because the value of money changes over time, we're talking about £1 billion that the government spent on this. So this starts to show us the changing attitudes of the government, the fact that they are now doing something about this cholera epidemic by actually improving the sewer system. So far we've looked at two things that led to the 1875 Second Public Health Act. We've talked about the work of John Snow, and we've also now talked about the Great Stink and the work of Basil Gett. So let's now talk about the 1875 Second Public Health Act. We've just been talking about factors that led to it, the work of individuals like Chadwick in his 1842 report, Snow in his 1854 reports, looking at the Great Stink of 1858. We've talked about working class men getting the vote. And the final person to just quickly mention is also the work of Louis Pasteur, who obviously proved the link between germs and diseases back in 1861, when he showed that germs even existed in the first place. Now, thinking about what this second public health did is really important. It builds on the first Public Health Act from 1848. So what does it do? Well, it forces councils to appoint health inspectors and sanitary inspectors to make sure that the new laws on hygiene are followed. Now, this is really crucial because the big weakness of the 1848 First Public Health Act is that it wasn't compulsory, but this time it is. Now they have a duty, and it says this in the Act, to provide things like clean running water and to make sure that there are waste collections. So the government now has to act on this, and there are people that are inspectors to make sure this happens. They also do things like improving the housing at the same time. So it's a really crucial act. It's very important that you know what it did. Now, this is a monumental change again. It's building on that first act. It's going a lot further than ever before, and it does improve a lot of people's lives. However, it is worth also being aware of the limitations of this. First of all, these improvements don't happen overnight. They take quite a long time to actually lead to some real changes. And second of all, even though the towns are now technically healthier, the people aren't necessarily any better off. So yes, the streets are cleaner, now they've got clean running water, but as we're going to see from the Liberal reforms in 1906 onwards, we're going to see that actually there's still a real problem with poverty and poor health that the government also needs to tackle. But it's a great start in them improving public health. As we've already seen, the 1875 Second Public Health Act massively improved the public health in different towns. People now had access to things like clean running water, and they also had access to waste collections. So there had been real improvements. However, these hadn't gone quite far enough. Now, the big issue that we have in the 1900s is trying to tackle poverty. Now, the government was really shocked in 1899 when they started trying to get some recruits from a war that was going on called the Boer War. And they found that lots of people were actually very unhealthy, and so unhealthy they were unfit to fight in war. They found that over a third of their recruits, 40% of them, were too unfit to fight. Now, this was really shocking for the government because they needed those people to be able to fight in the war. And the greatness of the British Empire was at stake in their mind. So this is something that led to some changes. This is one reason for the Liberal reforms. But another reason why the Liberals started passing some reforms in 1906 is because of the reports of two men called Booth and Rowntree. Now, one of them is looking at York and the other is looking at London. And they are looking here at the problems of poverty, just like Chadwick did back in 1842. So Rowntree studies York and he finds that nearly half of the working class people there live in poverty. And then Booth is looking at what it's like in London. And again, he's finding the same sort of thing about the fact that people are living in these terrible conditions, even if they've got two adults working in the family. So this is another thing that shocks people. They find examples of mothers going without food because they've given food to their children instead. They find in one example as well, over 15 people living and sharing one room and one bed. So there's lots of shocking statistics and facts that come out of these reports. Now this, along with things like the Boer War, leads the Liberal government to passing the Liberal reforms. And these take place between 1906 and 1914. And this is the first time ever we get something called the welfare state and some welfare reforms, where they're not only trying to improve public health by looking and making things cleaner, but actually they're trying to improve the health of the people. They're trying to tackle those issues of poverty. And they do lots of different things that we need to be aware of. Now, the first one to be aware of, a great example to use in your exams, is the 1906 Free School Meals Act, which brought in free school meals for children. Now, for some of them, that is their only hot meal of the day, and that was a really crucial thing in tackling poverty. We also get other things as well, like the Pensions Act of 1908, which brought in pensions for the over 70s, and we also get things like the National Insurance Act of 1911. Now, all of these are really important. If we take an example of the National Insurance Act, this is the only time where people would get some sick pay. Before this, if you were sick, you were expected to just deal with that because you wouldn't get any wages while you were off work. However, this is now giving some money to those people that have paid into the scheme. If they are made unemployed or they're too sick to work, it is giving them that much needed security and that much needed financial security blanket. So this is really crucial things that they are doing, and this starts with the Liberal government. Now, there's lots of reasons why they're doing this. As we mentioned about the Boer War, there's the work of Booth and Rowntree, but there's also the fear of the new Labour Party, which is created in the year 1900. So the government is doing this because they care about public health, but also they're worried about staying in power. At the bottom there, we've got a couple of other examples of other things that is going on at this time. For instance, David Lloyd George promise the soldiers returning from the battlegrounds of Europe homes fit for heroes, and they do provide a lot of homes for these British soldiers that return from the war. We also get something called the Ministry of Health being set up in 1919, which was set up to look after sanitation, healthcare and disease, as well as the training of doctors, nurses and dentists, and providing things like some maternity and children's welfare. So there's certainly been some massive improvements under the Liberals in the 1900s. However, we know that they go into a lot more depth and they go a lot further when we get to the 1940s and we get the Labour government creating the welfare state. But these Liberal reforms are really crucial, so please take your time to read over those if you can't remember any specific details about them. Now, we've just discussed the Liberal reforms of 1906 to 1914, and we've seen that they did provide things that no other government had provided before, and they were starting to take care of the health of the nation. However, despite all the positives of those Liberal reforms, there were still issues, even in 1942. So in 1942, 100 years after the Chadwick Report, comes the Beveridge Report. And this is where a man called Beveridge talked about the problems that are still existing in society. He talks about the 5 giants, things like want, disease, ignorance, squalor, and idleness. So he essentially talks about the problems caused by things like disease, the fact that people are living in these terrible conditions, the fact that there's not enough employment. He's talking about all those big issues and flagging them up to the government. Now, as a result of that Beveridge Report, the government does take responsibility more than ever before for caring for its citizens. Beveridge talks in his report about wanting to look after people from the cradle to the grave. He talks about looking after them for their entire lives. And after the war finishes, the government does start to act on this. Obviously, they can't do it during the war because they're very busy fighting the Nazis. However, afterwards, they do loads of things that help improve people's lives and look after people more than ever before. So the Liberal reforms were a great starting point, but the Labour welfare state takes those reforms and takes them much further. Now, you don't need to know every example in your answer for the mock, but you certainly do want to make sure that you're mentioning at least a couple of these key developments from the 1940s. So let's talk through some of them then. So in 1945, we get the Family Allowances Act, which gives a small payment for children. In 1947, we get the Town and Country Planning Act, which sets targets for the clearance of slums. Now, that's really important because even today, there are a lot of very strict rules about what quality of housing has to be like, and this all begins in 1947 with the Labour government introducing this act. Next, we have the really crucial one. No matter what, you want to remember 1948, 100 years after the first Public Health Act, we get the start of the NHS, something set up by the Health Minister Bevan. Great opposition at first, but he does it anyway, and it is something that is absolutely pivotal to our society today. So we need to know about the NHS, and the last one to be aware of is that in 1956, we get things like the Clean Air Act, which is trying to deal with the problems of pollution. So the Labour government in the 1940s takes really positive steps in looking after the health of the nation, 100 years after the first Public Health Act. When we've been discussing the Labour welfare state of the 1940s, we've already mentioned the NHS, but it's worth us talking it through in a little bit more detail because it is so crucial. Now, it was something that was created by the Health Minister Bevan, who was acting on the advice of Beveridge, who had written his report in 1942. It was a system of free healthcare that was revolutionary across the world and really demonstrates the fact that it was the end of the laissez-faire attitude. It had slowly been dying off with things like the Liberal reforms of 1906 to 1914. But actually, the fact that the government is now completely taking control of healthcare and public health and introducing this free system for everyone shows a drastic change in those attitudes over time. And it's a great one to use in your government paragraph of your 16 marker. Now, the NHS has been such a positive for our nation. It has meant that maternity services are available to everybody, and as a result of that, we get a lot less children and infants dying. We also have lots of hospitals where we know we can go if we need to. Before the NHS was created, millions of people had never seen a doctor, and that is not the case anymore. The NHS have also managed to eradicate diseases in Britain itself. Things like polio and TB aren't a worry to us anymore as a result. and it has dramatically improved life expectancy. So it is a real positive for us. So the NHS is a really key area to make sure that you know about. Obviously, there are still issues today with it, like the lack of funding and the fact that they will always have to prioritise some treatments over others. But generally, this has been a real positive and something that is a great example to use in your government paragraph. So the final thing to just say is that it's a really good idea to make a revision clock on public health and make sure you're revising that a lot before your mock exam. If you need any of the headings, I've put the 12 here. These are exactly the same as if you were told by Miss Bowden or Miss Eglin. It's the key areas that you need to make sure you're making your notes on. Now, I would make these notes using my blue fronted revision booklet that we gave you in the last few weeks, which is also on Show My Homework if you don't have a copy at home, but you can also use your exercise books as well. So make sure you're going over public health, use this PowerPoint if you want, and also make sure you check out Miss Bowden's narrated PowerPoint on individuals, because that will really help you. And there'll also be one going up which will talk to you about exam technique, including the 16-mark factor question. So thank you for listening to this. If you've got any questions, just put a note on Show My Homework and we'll make sure that we reply for you. Okay, thank you.